Good morning, all. So, today we will be studying our first topic, that is structure and characteristics of normal and cancer cell. So, before going to the differences of normal and cancer cell, we will go through some of the terminologies and about oncology. So, what do you mean by oncology? Oncology means the study of cancer. You all know it. So, oncology is a branch of science dealing with the study of masses or tumors, including their origin, development, presentation, diagnosis, and treatment. So, whatever comes under this, or everything will be dealing in oncology. So, from where this name came? So, the name is derived from a Greek word onkos. Onkos means mass or tumor. Some of the terminologies. First terminology is tumor. Tumor you have already heard before. Pallor, tumor, dolor, function lesion. That is the signs and symptoms of cardinal signs of inflammation. So tumor means swelling. Here also tumor means swelling or sometimes lump or mass. So tumor sometimes can be neoplastic or sometimes an accumulation of fluid. And next is neoplasm. Neoplasm is termed as an abnormal mass of tissue. Abnormal tissues are termed as neoplasm. These abnormal tissues are of no use. There is no purpose for this growth, and it will always harm the organism, organs, or all the body. So the neoplasm can be benign or malignant. Both benign and malignant can harm the body sometimes. Benign can harm the body sometimes. Malignant will surely harm the body. So we will study what is benign and malignant. So benign neoplasm is usually harmless growth, but because it will not spread to the nearby tissues or organs. But if the size is increasing, it can compress any vital organs or any vital structure of the body. For example, in mediastinum there is a benign neoplasm, and the neoplasm is been increasing its size in an uncontrolled way, and it can compress the heart, and the heart rate can be affected, or it can compress the lungs. The respiratory ventilation can be affected. So benign neoplasm can sometimes cause harm. Next is malignant neoplasm. Malignant neoplasms are harmful masses capable of invasion to other tissues. It can lead to metastasis, spreading of cancer from one place to another place, metastasis. So ultimately, cancer is termed as malignant neoplasm. Next is about, there are so many other terminologies we will be coming across those when we study the disease condition. Epidemiology means uh, how far the disease is being reached in the society or in a specified population. So epidemiology is the study of distribution and determinants of disease and health problems in a specified population. So this rate is not fixed, it is changing always. Globally, we can say 5.1% of total disease burden, and cancer is considered as 12. It is accounts cancer accounts 12.5% of all deaths. In the case of India, the cancer account 3.3% of disease burden in India and 9.9% of all deaths. I will not tell you to study this particular percentage by heart. This is always changing. Biology of cancer. So there are two major dysfunctions which is happening in the process of cancer development. So they are defective cell proliferation and defective cell differentiation. So we can study what is defective cell proliferation and defective cell differentiation. First one is defective cell proliferation or defect in cell proliferation. So you all know about stem cells. So what are they? Stem cells. So stem cells are undifferentiated cells or immature cells. In our body, most of the tissues contains stem cells. The stem cells is the one which will go what uh, go into the cell cycle and can produce the needed cells or differentiate into differentiated cells. For example, stem cells can be converted to muscle cells, blood cells, skeletal cells, or nerve cells, liver cells, or any type of cells. So, based on the need, stem cells can be differentiated into mature cells like muscle cells or any type of the cells. So, cell proliferation mainly occurring in the stem cells. So when the cell proliferation occurs, it will start when these stem cells enter into the cell cycle. When stem cell enter into cell cycle, cell proliferation starts. So while dealing with this, you have to understand four main heading. That is one is generation time of the cell, contact inhibition, pyramid effect, and doubling time. So we should know about these things. So what is generation time of the cell? That is a time from when a cell enter into the cell cycle till the particular cell divides into two identical cells. That is the generation time of the cell. So here in the cancer, this generation time is affected. And next, contact inhibition. So the main functions of the different types of cells. We know that we are having different types of cells in the body. For example, blood cells, muscle cells, skeletal cells, several types of cells. So these cells are not mixing up. So they are having particular respect to each boundaries of the cells. For example, the bone cells, osteocytes, osteoblasts are not going beyond to the or it is not going or growing through the muscle cells. So these are respecting the boundaries and territory of the other cells which is surrounding them. That is contact inhibition. How this occurs means these cells, if they are physically contacted, automatically they got inhibited the growth further. So that is normally happen. But this contact inhibition is not there for cancer cells. Cancer cells cannot identify the other cells. It will grow through, beyond, down, or up. Any way it can survive or it can grow. So in normal conditions, cell proliferation equals to cell degeneration or death. But in cancer condition, the cell proliferation is not equal to cell death. And next is regarding the rate of proliferation. So in cancer as well as in normal cell, the rate of proliferation is almost similar. For example, one cell can be converted to two, two can converted to four, four will become 8 and 16 and go on. So in normal cells, what happens when an adequate number is being reached, the cells are being dividing, and the body find it out the number is enough, and the body can give negative feedback or signals, and that cells are able to identify the signals. Okay, further proliferation is not needed. Then the proliferation stops. But in cancer cells, that doesn't work. Cancer cells are not able to understand the signals, or it will not obey the signals. It will go on multiplying and multiplying, but the rate is similar to normal cell proliferation rate. And this particular effect is termed as pyramid effect. So what is pyramid effect? The cancer cells are not able to identify the signals, and it will go on its own growth or multiply by its own. That is pyramid effect. And the time which required for a tumor mass to double its size is termed as doubling time. So these are the most four things you have to understand. Generation time of the cell, contact inhibition, pyramid effect, and doubling down. And next is defect in cell differentiation. So I have already told before, a stem cell is an immature cell. It can be differentiated, that is an indifferentiated cells. Stem cells are indifferentiated cells, can be differentiated into any type of cells. That means immature cell, that is a stem cell, can be converted to a mature cell. That is termed as cell differentiation. Here in cancer cells, that differentiation is not happening. So going back to the main heading, two major dysfunctions: defective cell proliferation and defective cell differentiation. Next, balance of cell proliferation and cell differentiation. So, in our body, the cell proliferation and cell differentiation is controlled by two main genes. These genes are proto-oncogenes and tumor suppressor genes. So, what are proto-oncogenes? These are normal genes which are able to promote the growth, whereas tumor suppressor genes are able to control the growth. So these proto-oncogenes and tumor suppressor genes are equal, balancing. When proto-oncogenes are producing new or promoting the growth, tumor suppressor genes are able to control the growth, suppress the growth. But in cancer, what happens is the proto-oncogenes undergo mutation due to exposure to carcinogens. So this proto-oncogenes is converted to abnormal gene called oncogenes, and these oncogenes are tumor inducing genes. These oncogenes can produce cancer cells. Meanwhile, the tumor suppressor genes can go mutated and will lose its function. The tumor suppressor gene are no more able to control the or suppress the growth. So when abnormal growths are being occurring in the body, the tumor suppressor gene is not able to control or suppress the abnormal growth. So that is a balance you have to understand. Balance of proto-oncogenes and tumor suppressor genes.